So I'll go ahead and start. Rich McLean, I'm on the board of the Aurora Health Alliance, and especially within the Access to Specialty Care Committee, which is going to be the hot topic for today's discussion. Mandy.
Hi, Mandy Ashley, Director of the Aurora Health Alliance. I'm going to call on Emma because I haven't seen you in forever, heard your voice.
You're too kind. Hey, Mandy.
Hi, who are you?
Hey, everyone. Emmanuel Cruz, 3.5 year medical student here at CU. I worked with Aurora Health Alliance, had a great time, and very interested in specialty care access. So thanks. Yeah.
Well, how about Brianna?
Hi, Brianna Teeters. I'm with Echo Colorado. And I think I'm here today to just give a quick update on our eConsult community of practice. I'll hand it over. Are we still doing introductions?
Yes, please.
Okay. I'll hand it over to Dana.
Hi, good morning, everyone. I'm Dana Chang. I am the evaluation specialist from HCPF. And I'll hand it over to Emily.
Hi, everyone. Good morning. Emily Wessner, eConsult Contract Administrator on the HCPF side, and I will turn it over to Andy.
Morning, everyone. Andy Bradley at HCPF, and I also support the eConsult work here at HCPF. I'll pass it off to Heather.
Andy. Heather Steele, I'm the Provider Relations Manager at Safety Net Connect, and we're in charge of the development and implementation of the Colorado Medicaid eConsult platform on behalf of HCPF. And I'll pass it to my partner, Shamika.
Hi, good morning, everyone. I'm Shamika Mane, and I'm the eConsult Project Manager at Safety Net Connect, and I'll pass it off to Andrew.
Hi, everyone. Good morning. I'm Andrew, and I'm a project coordinator at Safety Net Connect. And I will pass it over to Rain.
Hello, good morning. Rain Henry, Hospital and Specialty Care Section Manager here at the department. Some of the elements fall under me, pre-consult as well, because we have it everywhere in the department. I'll pass it over to Chris.
Hi, good morning. Chris Lane. I'm the Specialty Care and Facilities Unit Manager in the Health Policy Office at HCPF under Rain. And let's see, I'm not sure who hasn't gone yet.
I can go ahead and go. My name
Please.
is Myra. I am the program coordinator for the eConsult program here at the University of Colorado. And Angelica, do you want to go next?
Yeah, sure. Thank you. My name is Angelica Pinedo. I work in a community health department at Kaiser Permanente, and I manage our external eConsult program here.
How about Jacqueline?
I'm sorry. I'm Jacqueline Stanton, and I am a community member, and I'm here representing folks who want to know more about this process. Thank you.
I can go while we're waiting.
Okay, go ahead, Heather. Carrie.
I'll just introduce myself quick. Sorry, I was a few minutes late. I'm Carrie Mader. I am the medical director for our specialty care in the School of Medicine and help co-lead this group with Rich.
And this is Tina. I don't think I was unmuted, but I'm Tina Finlayson, and I'm a medical director at CU Medicine for Medicaid Services.
Okay. Deidre.
Hi, sorry, all. This is Deborah Para-Medina. I'm on my phone, so I was trying to figure out how to unmute. But I am the executive director for the Center for Health Equity at Anschutz Medical Campus, and I'm just here to learn about the work in this working group.
Thank you, Deborah. Deidre, did we hear from you yet?
No, you haven't. This is Deirdre Callahan, University of Colorado School of Dental Medicine. I'm faculty here. Hello, everybody.
Well, Neil, good to see you. Who are you?
Hi, Rich. Hi, everyone. Neil Kraus. I'm the Assistant Vice Chancellor for Initiatives and Community Engagement at CU Anschutz.
Thank you, Neil. How about Maisha?
Good morning, everyone. My name is Maisha Fields. I'm a nurse practitioner, resident of Aurora, born and raised right here in Aurora. And I am the Vice President of Programs and Community Partnerships for Salud Family Health. And I am also the President of the National Black Nurses Association here in Colorado.
Thank you. Is anybody that?
Dr. Wright.
Hi, everybody. I'm Bill Wright.
Yes.
I'm the Chief Medical Officer for Colorado Access. Happy to be here.
So I think we've covered everyone. So as you know, access to specialty care is a significant interest group in Aurora. Has been forever because there are access to specialty care issues, and it's a huge issue. Not enough providers, too much demand. It's that type of thing that we're resolving. We have a nice eclectic group of people here that are interested in topics, so it's wonderful that you're here. So Carrie, Dr. Mader and I just kind of co-chair this work group. And the greatest innovation we've seen have been, well, a couple at least, a lot of community, a lot of providers, a lot of people with skin in the game of healthcare. This is a big topic for them. And we actually have a platform, eConsult platform, that is statewide, not just for Aurora, but statewide, that could help and should help reduce the barriers to specialty care in these times, which have existed forever and are not getting better, but eConsults are going to help. Our friends at within Aurora, of course, we're focused on Aurora because there's a huge issue here. We have so many people on Medicaid as well as uninsured, and it's a travail out there in the community. So our array is Colorado Access. Again, and we will partner. We want to partner with Colorado Access, obviously, in doing better things in specialty care, for specialty care access. Is there a representative from Colorado Access that can kind of say what they're doing and what they're planning coming this summer, or have things changed as Colorado Access became the new Ray? William or anybody out there or Colorado Access?
I'll jump in because I'm not seeing anybody else kind of scanning the crowd here. So you got me. So obviously supporting the eConsult work is very important to us. Also working directly with providers, primary care particularly, because I think what we have found through our practice support, there's actually microcosms even through Aurora where some specialties are better represented than other specialties, or to be quite honest, people have figured out informal connections with. So anyway, just to finish up, working with some of the micro areas within Aurora, because a lot of practices have developed some very informal handshake type arrangements with folks literally in their building across the street, in their immediate neighborhood. We do know that this is not sustainable. We are, talking to the primary care societies, Colorado Commission for Family Medicine, the broader issues of just getting medical students to choose primary care specialties and that's part of our problem on that side. But what we're also finding the thing with the specialty consultation is that a lot of them have joined organizations that the organization is prohibiting some of that access, whether it's a consolidation or health systems, et cetera. So that's why we appreciate the partnership with CU, with Kaiser, with Denver Health, et cetera, because you're sort of our last resort. So anyway, I'm here more as a learner than an expert, so I appreciate what everybody's doing.
Bill, do you know if specialty care access navigation is something that's on the agenda this summer for Colorado Access?
Yeah, it's front and center because, as you guys know, the phase 2 of the contract is ending here as of the end of June. So we're going into phase 3 with the rebidding. So we were regions 3 and 5. Now we are Region 4, of the 4 Ray regions across the state. That is front and center on the expectations from HCPF on our contract requirements that we continue to work this problem. So I think you'll see increasing focus through our practice support teams and our network support teams as well.
Okay. Yeah, we would certainly within the Rural Health Alliance want to work with Colorado Access on that, and especially with e-consults, because that's something that's tangible and that we can actually work together on, especially if there are clinics out there that haven't signed up for any e-consult program.
And I guess the last thing I'll say on that, I'm really appreciative of the incredible work that's going on with e-consult, and have partnered with them on a few of those meetings. The biggest pushback that we get, and I know e-consult hears this from our primary care folks, one, they're on roller skates, hair on fire, trying to get through their day. And just the seconds or the extra steps it's taking for them to maybe go from one platform to another. We hear all of these things. So the more we're working on that seamless integration, and it's happening slowly, and I think good work is going on, but the more we can take fewer clicks to complete the process and reduce the amount of time popping in from one system to another, I think we'll continue to see the uptake. And the best thing that works for us is if we can get the zealots or the evangelists out there that have experienced the benefit of it and get them out in front and convincing their peers. So I'll stop with that.
Thank you, Bill. And I see Jamie has joined us. Jamie, insight on that follow up with what Bill is saying about Colorado Access and its initiatives on e-consults?
I don't, sorry, and I hopped on right as he was wrapping up. I do know, in phase 3, big thing we'll be doing is, from a care management lens, trying to track what's going on in the specialty network, the struggles that our members are encountering. I think it'll be more on the provider side, that encouragement of the e-consult, but probably some education for our staff as well to share, when they're talking to providers, that it is something that's available to them as an option if a member is maybe struggling to get in with a specialist. Because we hear that a lot, that there's maybe a 6-month wait list. So how could we maybe call the primary to say, hey, this is a tool that you could use. Here's what we're running into with your patient. We can't get them in to see the endocrinologist for 6 months or something, but that's what I know right now. I know we'll work closely with our practice support team as well. So sorry that I joined late there.
Well, I'm glad you could join us and hear the dialogue, and we get some update, and for us to hear the update, and that especially that Colorado Access is still on board in these changing times. They still have a responsibility and a mission for coming up in this summer for access to specialty care navigation. I believe that's still true, right, Jamie?
Yeah, and our staff do a lot of tracking that our quality team currently, we report if we're talking to a member and let's say they are having a challenge getting in. We have a form that our staff actually submit that our quality team then gets to kind of see, like, what are we hearing from the members? Is it that this wait for this specific specialty, they called 7 providers, and here's what they're all hearing, so that they can then look into what might be going on, and then we can communicate those things back to healthcare policy and financing. So we've been doing some of that in phase 2. And I think, we'll continue. I foresee us continuing to do that because it is, our staff are hearing firsthand from the members the challenges that they're having when they are interacting with them, so that we can best support and identify the challenges in the network. So we'll continue that, the boots on the ground, hearing the people and the challenges they're experiencing, to relay those concerns, because they hear it all day, every day, the things. So it's important that we have a way for them to report those things back up to our teams to investigate. So.
Thank you. That's good to know. We really do want to partner strongly with Colorado Access in addressing something, the big iceberg of access to care, but working with you and with Safety Net Connect and HCPF can we chip away at that more than we've done before? Carrie, you went off mute. Did you want to say something?
Yeah, I was just gonna ask a question of Jamie and Bill, kind of related to that, this concept of calling 7 different practices, and it's been a consistent narrative probably for like 10 years now out of AHA, out of Mile High Health Alliance, that transparency of the network and just like who is open to patients and who is not, and churn on and off of being open to Medicaid patients is a significant barrier and takes so much time out of so many people. And I was curious if, I think I got to meet and talk to Dana Pepper about this a number of months ago. And I was curious if there are discussions with kind of the specialty care navigation kind of mandate coming down the pipeline, if there are discussions around trying to build more network transparency, even among these like handshake clinics, either from a RAY perspective or from a HCPF perspective. Are there discussions or momentum around that?
Well, I'll jump in. I guess there's some aspirations, maybe would be a better way to put it. I mean, in a perfect world, we would love to have a select network that we could actually begin to direct people, but we're way far from there. And what's happened that we hear from our frontline primary care people, what used to be these handshake things that would work for them quite successfully, because there was a relationship that could call somebody, yeah, I'll squeeze that patient in, blah, 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 you know the drill. The heart may still be there. Oh, I want to help out, but now I'm working in a setting which has just basically said, no, I can't, you know. So to Jamie's point, we're just trying to document that information and understand that. But I think just some of the moves, as you know, Carrie, behind the scenes on what's going on, you know, with even how a lot of specialists are organized and paid and contracted, that ends up being more barriers. So we almost feel like that we need to sort of create our own, I'm putting this in air quotes, and please don't quote me, our own kind of select network that we could have a reliable, consistent, dependable relationship with. But we are so far from that.
Yeah. And Bill, I was going to add too, I think, you know, some of the challenges have just been like the updated directory and like finding a good tool that's easy for providers to update quickly, right? Like, yes, I'm taking new patients. No, I'm not. Like, because I think that's been a challenge too, is just utilizing a directory that appears that somebody is taking, you know, an open, and then you call and they're not, but like, you know, I don't know the 5 million different steps it might take just to even update that directory. Like, what does the provider have to do on their end? Like, so I feel like there is probably appetite out there for a better directory as well that isn't as administratively cumbersome on the provider side, where it is easy and maybe more enticing for a provider to update versus maybe a lot of steps that I'm not sure if that deters providers currently from even updating. If it's like I have to log in to and authenticate 20 different times just to say I'm not open. Like, so how do we find a tool you know, that can do that more easy, you know, for the providers, that then keeps it up to date. So because I know that's a pain point, even for our members when they do call in and they try to use, let's say, what's on the state website. They're like, I tried that directory and every provider I called isn't open, but it says they are. And, you know, from that member experience, that's really frustrating. And that's when our staff are picking up the phone and calling a lot of different offices just to see, but we don't have that control over updating the directory necessarily, but that's why we report those things though too, then our staff can, because I even think in our form, I can't remember, like we often ask our staff, well, like, what did the directory tell you that they were open, so that they can also see this is a you know, a problem, like oh yeah, the directory was actually updated, you know, I don't know, we're trying to improve that too. So I would say aspirational, yeah, in air quotes, to
Yeah.
Bill's stuff.
And the last thing, Carrie, you know, we, as you know, we do contract with PCMPs, right? I mean, we don't pay their claims. They send their claims to HCPF, but we do provide some incentivization for certain performances on, as you know, quality metrics, access, that kind of stuff. We don't have those kind of relationships with specialists. Specialists are either contracted to be on Medicaid or not, but they do not have a contract with us as far as a provider on our panel, if that makes sense.
Yeah, what you have outlined is the ongoing problem, and it does, we need a direction for resolution on it. One thing that we want to do in the Rural Health Alliance is out there in the trenches when people cannot get specialty care. They have Medicaid, but they cannot get specialty care. What guidelines can we provide them under the current environment to give them hope, so they're not just wallowing and say, well, I'll just wait till I have to go to the emergency room. That certainly is something that we do want to work on, and I've talked to Neil about it, and hopefully it's not only a UC Health problem at all. It's everyone, that all our systems are involved in this. So we do want to see if we can come up with some guidelines, given the current state, given that we don't have a reliable directory.
And I was going to add too, I think something at least when I was a care manager, I would encourage, and I think a lot of our staff do, is educating the member too. Just because somewhere says, no, not right now, asking, can I get on the cancellation list? So if you do have something, right, like just educating, like that's an option. And also educating people, because I think sometimes people get really particular. I just want to see X doctor at X practice. Well, they have a PA there or a nurse practitioner that could maybe get you in sooner. So educating too, that you know, kind of teaching them the options they may have available too. So it's not just because you can't get into that one doctor you wanted. Do they have a PA or a nurse practitioner that could see you sooner? Do they have a cancellation list? So kind of educating them too, to ask the right questions when they're calling. So I used to call when I was a care manager, like with the member on the phone, so they could hear the questions that I would ask the front desk person. Because, they would just hear the no. And then they, okay, click. And they would hear me ask the questions, and, some of them ended up getting on the cancellation list and could get in. So I think there's also that education piece is how a patient can navigate or ask the right questions too. So.
You're right. We want to work with you on that, Jamie. You've outlined it so well. I just see so many people out there that go through exactly what you do. No, we don't have any appointments. Click. No,
Yeah,
there's got to be more.
Yeah. And so it's fun to help people learn to do that and I help my parents with that too. I'm like, no, Dad, like, let's call back. Like, we can work something out. So.
Well, I do want to bring in Safety Net Connect and HCPF, but Carrie, did you have a comment on that?
I was just gonna say, Jamie, I think you're bringing up something that Rich and I have been talking about for the last few months. I think there's that is potentially something that this group could work on, is kind of the community education side. If we can't change the system, how do we at least teach patients how to navigate the system? And so I think that's something that we can put on the agenda for a future meeting. That would be great to talk about. And then also time check for making sure that our Safety Net Connect and HCPF partners on this call have time. And then we do want to make sure the community practice from CU has some time too. So just a quick time check.
Yeah, thank you. So Heather, Emily, you've heard our travail. I mean, you hear this across the state. It's just not us, it's everybody. But we're so excited and so happy to have a platform that's statewide called the eConsult platform. How are we doing there? What are the barriers? What are the good things happening? And what are the things that could be going better with the eConsult platform that can begin to address this iceberg problem that we have out here with access to specialty care? Anybody from Safety Net Connect or HCPF that would want to comment on it? Heather, you've always been so proactive.
Oh yeah, I have no, I just have a love for eConsults because it's affected me personally. So, and I live in rural Colorado, so I understand the unique challenges to access to specialty care. But I know that Dana and Emily have a presentation to give you updates on how we're doing. But I think all of this is just a great conversation, and also being a former practice transformation coach for Rocky, I have a little bit of insight into what Colorado Access does, and agree with Bill that, you know, if there's a way to somehow capitalize on the benefit of eConsult for the specialist, we might have an opportunity to increase utilization of eConsult and also support, you know, what specialists want in enhanced referrals. And so I think there is opportunity there for eConsult to help continuing to increase access.
Who should we pass it on to then, Heather?
To Dana and Emily.
Thanks, Heather. I'm going to go ahead and share my screen, so then we can go ahead and get started with our presentation. Okay, great. So this is just a look at our agenda for today. So we'll do a brief overview to those that are new to eConsult. We'll take a look at our available specialties that we have on the platform. Then Dana will go through a progress update as to where we are today. And then I will talk a little bit more about the specialty to specialty feature that's coming down the pipeline, and then how to participate. Okay, so here's a brief overview for you all. So we just celebrated our 1-year anniversary, which is super exciting. We launched a year ago on February 1st. Safety Net Connect is our vendor who developed our platform. They are also responsible for enrolling and onboarding all of our users. Training practitioners can also use approved third-party platforms beyond ours, which gives providers greater flexibility and options. We've also opened up the billing codes to allow any provider to bill fee-for-service, which helps expand access to specialty care statewide. And then we have a billing link too for what's approved in terms of third-party billing. So Colorado Medicaid eConsult is free. It's a web-based platform. Only a web browser and internet connection are required. No software installation is needed. Our platform also supports single sign-on and data integration with capable EHRs. I do want to highlight that Safety Net Connect has successfully integrated with, I believe we're up to 4. Is that right, Heather? Yeah. We're up to 4 full integrations. Yeah, which is super exciting. We're really proud of that work that's been done. So the integration component is available. So what is eConsult? Electronic consults or eConsults are asynchronous store and forward clinical communications between a primary care medical provider and a specialty provider to transmit secure eConsult requests to specialists. So here's just a look at our benefits of eConsult. It improves access and faster treatment. We've seen stronger provider relationships, and we're seeing cost reduction and lower healthcare costs by preventing unnecessary high-cost specialty visits and acute care incidents while enabling better management of conditions through improved provider coordination. This just looks at our available specialties that we have to date. We have 21 adult specialties and 16 pediatric specialties. We recently have added OBGYN for adolescents ages 14 and up, which is very exciting. And then we're still currently in the process of recruiting adult and pediatric ophthalmology. I'm going to turn it over to Dana, who's going to walk us through some data.
Thank you, Emily. Good morning. I'm Dana. Happy to be here again to share our eConsult progress. So this is the eConsult submissions by month from February 2024 through January 2025. And from the bar chart, it's a stack chart including pediatric eConsults and adult eConsults from February last year. The utilization increased in July, August, and September. That is because the department allocated the leftover fund to the RAIS to promote eConsult utilization. Prior to receiving the funds, each RAI had to submit implementation plan to HCPF. and let us know how each Ray are going to promote eConsult utilization in the area. After the incentive program ended, Ray submitted their implementation deliverables and expense table. The red bar represents the pediatric eConsults. That's a total of 199 in the past 12 months. And the teal bar represents the adult eConsults. That's a total of 493. So the total in the past 12 months, we have 692 eConsult have been submitted to the platform. Next slide, please. This is the top 10 submissions by each specialty. We only show the top 10 from endocrinology through urology. And again, this is a stacked bar chart combining pediatric and adults eConsult. So the top 1 overall is the endocrinology, top 2 is dermatology, and top 3 is urology. And when we look at the data by pediatric and adult by itself, the adult top 3 is endocrinology, neurology, and rheumatology. For pediatric eConsult is dermatology, psychiatry, and neurology. In the previous slides, we mentioned we have a total of 21 adult specialty available and 16 pediatric available. And just to note that all of the available specialty had received at least 1 eConsult submissions. This is the eConsult submissions by Ray and by their county designation. I saw a question from the chat. Is it a question to me?
That was from Aisha.
Yes, I was just questioning about the census. How many patients does this data represent?
Total eConsult, we have 692 eConsult.
Okay, thank you.
You're welcome. So for this slide is the submissions by Ray from Ray 2 to Ray 7. And Ray 1 has not submitted any eConsult yet. That's why there's no bar chart here because Ray 1, it has its own eConsult program called Colorado Specialty Care Connect for all their eligible members. So they have their own platform, but we still have a few clinics sign up to our Colorado Medicaid eConsult platform. And we can see from Ray 2 and Ray 5, there are low utilization there. That may be because their provider are using the third-party platform. Because we know Ray 2, there are Banner Health organizations, and Ray 5, there are Denver Health and UC Health. In the bar chart here, the yellow represent the rural area and the red represent the frontier area. And most eConsult submitted are from the urban counties.
And Ray 4 is the one here, is Colorado Access, isn't it?
We will be in phase 3. For right now, we would be region 3 and region 5.
Okay, all right.
Region 3 and 5.
Ray 4 is doing gangbusters. Who are they? Is that the Colorado Springs one?
I want to say, are they on the 6 and 7 is a Jeffco and then Colorado Springs area. 4 would be more like Western Slope. And to me, that actually makes more sense because I feel like they are lacking specialists out there since they're more, you know, they're out west, and I would imagine they don't have as much access as we do in the metro area.
Ray 4 is Health Colorado, so that's the Pueblo and southeastern area. So yes, more rural area, Jamie. And then Ray 1 is actually the Western Slope, Rocky Mountain Health Plans. Yeah.
My brain today.
No worries. We don't have those outlined.
Thank you, Heather. Next slide, please.
I have a clarifying question. This is Maisha. For Ray 5, that's UC Health, is that correct?
Yes.
Okay. And why are their numbers lower? What system are they using? Because we're having difficulty with our patients from Salud with consulting with them for specialty care. Are they using a different system that maybe we're not aware of?
They have their own eConsult system. within
And-
their EMR.
They do, and then CU Medicine provides e-consult service for Salute, I think.
Yes.
Isn't, I thought Ray 5 was actually City of Denver, in the old
Yeah.
Denver County. Mhm.
Yeah.
Mhm.
Denver Health and UC Health are under Ray 5, and they have their own e-consult system already. So that's why we see the low utilization. And this one shows the blue bar chart shows the eligible sites. They are eligible to participate in the Colorado e-consult platform. And the yellow bar chart shows the number of trained sites. They are trained and enrolled, ready to use the platform. So as a total, there are 190 treating practitioner practice sites successfully completing on board, and 494 treating practitioners. They are enrolled and trained for the platform. And from our data, at least we have 212 treating practitioners submitted at least one e-consult. They are actively using our platform. And you can see that on the Ray 1, there's no blue bar behind the yellow. That's because, again, Ray 1, they have their own e-consult platform, but we do have 5 clinics. They reach out to us and would like to participate in our platform voluntarily. And there's a side note is that clinic, they can choose to participate one or more platforms. So they can use their own existing third-party platform, and they can also still participate in our Colorado Medicaid e-consult platform. Next slide, please. So this is the slide that we pull out specifically for the data within the Aurora City PCNP practice sites. So looking at this area, we have 36 PCNP practice sites eligible to participate. And a note to that is those 36 does not include UC Health. And out of that 36, 4 of them already participate in our platform. And from those 4 practice sites, they have submitted a total of 16 e-consult in the past 12 months. So we see the opportunity here that 32 additional sites, they're eligible to participate, and that is something we're working on. This is the e-consult outcomes from February last year to January this year. So once the e-consult is closed, there are 4 major outcomes. Number 1 is the PCNP management. That means the specialist has provided guidance for the PCNPs to carry out next step. And the second one is further workup recommended. That means the specialist suggests additional steps, such as lab tests or clinical assessments to get more information. So combining those 2 outcomes that accounted for 90% of the e-consult that provide actionable guidance to the PCNPs to carry out next steps that avoid the face-to-face in-person visit for the member. And the average response time is less than 1 business day. And because PCNPs, after they receive the specialist response, they still have time to review that and close the e-consult. So in this chart, we only have 680 e-consult available to show here because they are closed with the PCNPs. That means they have received the response and know how to carry out the next step. We do have 61 out of those 680 that is face-to-face recommended, and 8 of them closed as specialty change. That means the specialist recommend that condition needs to be taken care of by another specialty. So they close that e-consult, and the PCNP need to submit a new e-consult to start the conversation. And we receive provider feedback. A lot of provider told us that it's so easy to use the platform. They received the feedback just within 1 business days, and the average time is 1 business day. And when I look into the data specifically, the most time is like 2 days. So for the providers using our platform, they get response like within 1 or 2 business days. So that's a quick response turnaround. Next slide, please. And I'll turn it back to Emily. Thank you.
Thanks, Dina. So this slide just goes over our steps to participate. So providers who are interested in participating should complete the following steps below. So they'll email SafetyNet Connect at Colorado Support at safetynetconnect.com, or complete the practice enrollment form, which can be found on SafetyNet Connect's website, which we can drop the link in the chat. And we'll also share this slide deck out to you all too after today. So SafetyNet Connect then sends practice enrollment and user creation forms for completion. Once those forms are returned, then SNC will confirm the enrollment, and then they will send training options and registration links to the practice. So this just looks at our specialty to specialty feature that's coming down the pipeline for a July 1st launch. So our current treating practitioner user role will be expanded into a more generalized submitter role. The plan is to add new fields to differentiate between the types of submitters. In terms of eligibility, specialists who are MDs, DOs, NPs, or PAs will have the ability to submit e-consults as a submitter. Our limitations: behavioral health providers are not able to submit e-consults as treating practitioners or serve as specialists on the platform. Our platform allows treating practitioners to seek clinical guidance from addiction medicine and psychiatry specialists on non-urgent medical care and medication management related to behavioral health issues. And the overall impact of the specialty feature is to expand the engagement of healthcare professionals to improve access to care, support member well-being, and facilitate the co-management of members with complex multi-specialty needs. So right now we are in the process of getting our rule updated, which will then need to go to the Medical Services Board for review and approval. And then our hope is that we will go live with this feature on July 1st. So here's just a few examples of specialty e-consults. I'm just going to read the middle one. So cardiology to nephrology. Cardiologist is treating a patient with heart failure and requests an e-consult from a nephrologist to assess kidney function before starting an ACE inhibitor. The benefit is to safeguard the patient's kidney health while optimizing heart failure management. So we're finding that by adding this feature, we'll just be able to, again, increase access to specialty care, which is our overall goal. And we're really hoping that we'll see utilization continue to increase. And then in terms of, for the new RAY contracts that will begin on July 1st, we do have performance standards implemented. So we're, the RAY contract language has not been 100% finalized yet from my understanding, but we're hoping that in the RAY contract, there will be a 2% annual increase in adoption. So RAYs will be required to achieve a 2% annual increase in adoption of e-consults using any department approved platform. Again, criteria will be found in the billing manual for this. The percentage of PCMPs using e-consult. So RAYs must achieve an agreed upon percentage of PCMPs who have adopted a department approved platform and submitted an e-consult within the past 12 months. And in terms of the implementation timeline, we're not planning to enforce these performance standards until state fiscal year 26-27 or later, as determined by the department. As I mentioned before, this is just very general goals that we have for the new RAY contracts. It's not 100% concrete yet. And that's it. So we will go ahead and open it up for Q&A.
And Bill, you had some questions.
Yeah, thank you, Emily. That was really awesome. early on, the decision was made to allow primary care folks request a specific specialist, I actually by name, because it was somebody they knew or whatever. And I'm wondering, my prediction back at the time is that might be a great way to kind of get them to get on and get comfortable, and maybe that would slow down and they'd be more comfortable with taking whoever's up in the queue. But do you guys have any idea if that's still happening behind the scenes?
Hey, Bill, I can answer that. So just for context for the group, the Colorado Medicaid eConsult platform does have options to allow the submitter to be able to directly select a specialist for their eConsult. And that's a Colorado-based or national-based specialist. They also have the opportunity to just leave it as next available. And that just will go to the next available specialist in the queue to receive that consult. So Bill, to answer your question, we do see providers that are directly selecting, but the majority of them are using the next available so that it's going to the next available specialist.
I think that's great news, actually. Thanks, Shamika.
What other questions? Now we're scheduled to go till 11:30. I know a lot of people probably want to drop off at 11, and we want to have an update with what's going on in the Anschutz campus. Any other questions? There's a lot of good stuff here and certainly a lot of things that we can move forward on.
To Brianna, did I say it right?
Yes, Brianna.
Okay.
So thank you. Thank you for inviting me. Once again, I'm Brianna Teeters. I'm with Echo Colorado, and I serve as the project manager for the Colorado eConsult Community Connections, or our community of practice. So I'll just give a brief overview of this series. So the Community of Practice is a partnership between the CU School of Medicine and the Office of eHealth Innovation. The focus of this Community of Practice is to break through the silos that exist across the eConsult platforms across the state, as well as health systems, and to support a strategic expansion statewide, because all of our platforms do interact with different communities. And just making it a space where all the different platforms can discuss what's going well, what isn't going well, challenges they're running into, and hopefully just trying to really align with the work that we're doing, so we're not duplicating efforts, and can hopefully come up with a place for a lot of great information and data and conversation as we move into expansion, and as well as under here, I have the series goals that we came up with, but determining informed next steps in these potential for a statewide eConsult education. Just as mentioned, ensuring that providers are aware that these platforms exist, how to access them, best practices, etc. So this is our list of current participating platforms that we have right now. Which is also great because they're, it's good seeing familiar names here too. And then just quick for our next steps, we've had 2 meetings. Our February meeting was actually yesterday. We're kind of going at the cadence of every other month, so we're planning to meet in April and June, with those sessions moving forward of continuing to see if there's other partners or platforms that we should look to include, potentially with the FQHCs, potentially bringing in providers to discuss their experience, just really looking to be a nimble place to kind of just address what challenges are brought up by the group, and hopefully just being a place where we can address those challenges in a less informal way. Yeah, so that's all that I have.
Well, Brianna, I think it was in Dana's presentation, she about within Aurora Ray 3. She mentioned there are 32 eligible organizations that could participate. but are not for various reasons? Is that something you're aware of and would work on within your program?
So I'm not sure which organizations those would be. I'm not, I do, like I said, with my work with Echo is kind of bridging our two platforms. So I'm not, don't have a lot of information as far as providers and which platform would be best used for them.
So that's a little complicating factor. Probably they might use, well, they use UC Health System or others, but it's good to know. Are they using any, or is there intimidation? I think Bill kind of mentioned it. It's a job, and their providers are swamped. Is that the issue? It would be nice to get a handle on that and help providers who don't have an e-consult platform understand that this would help their e-consult. Any e-consult should help, and there's one available that's free and fairly easy to become partners with.
Yes, and that is, of course, a challenge that has been brought up about the additional work that comes with PCPs submitting e-consults and then specialists responding to them. And hopefully something that we're going to be able to provide some opportunity for support from this.
Well, thank you so much for sharing. We had originally we were talking about this meeting having kind of like a panel of the different e-consult platforms interacting in Aurora to learn, oh, what are you guys learning from each other? Is there a way to put everybody in the same room to figure out if there's themes that AHA could support? And you guys, and then we found out this community of practice was starting. So that's already happening. We would love to have an update maybe at our next meeting in May, if that's the right timing from the various e-consult platforms interacting in Aurora to see if there's something we could support through this venue. So we can circle back on if that's the right timing or if there needs to be a few more months for convening before we get to that point.
I would like
Dana?
to add about those 32 opportunity eligible practices. Those are not part of the UC Health or Denver Health. So those are some clinics that maybe they don't have any platform using. Yeah.
So
And-
working with Colorado Access, Dana, you could identify those and maybe we can encourage them.
I think we can work on that together.
Okay.
I know we're almost to the top of the hour, though we blocked a little bit more time. We wanted to give just a few minutes that if anybody else on the call has updates on the programs you're representing or that you want to bring to the group, just wanted to give some time in case folks need to drop. Brianna was the one giving the update from the Peer Mentored Care Collaborative. Living under Peer Mentored PMCC, Peer Mentored Care Collaborative, is the Project Echo program.
Okay.
Which brings together, providers, practice administrators, and then the e-consult program. But Brianna was here to give that update on the echo around e-consults. So
yeah, well, go ahead
there.
and proceed. And then if we, people have to drop off, usually we do an hour, but this is such an interesting topic and an important one. Give an update. And then afterwards, I'd like to just kind of brainstorm with folks. What is the new normal in our health industry here? How do they foresee things changing? And what do we look forward to? So Carrie, go ahead and a specialist guru in Aurora.
I know lots of experiences. I don't know that I have much power to change anything, but my goal is to just put people in the same room because I think good things happen when people get in the same room together. I'll give a quick update from wearing my hat as medical director for Aurora Specialty Care. I gave you guys an update at the last meeting about one primary project that I've been working on after a bit of a needs assessment phase, which was recognizing that a lot of times when we talk about specialty care, the conversation always goes to appointments and kind of direct access. so that there's these resources like e-consults, as well as some institutions have put out kind of what we call clinical pathways or practice guidelines that are easily accessible that help a primary care provider know what to do right away at the point of care. And that there are resources upstream of direct appointments that are being underutilized. And so one project that I've started now is working with Stride, one of the anchor FQs in Aurora, on doing what we're calling the Specialty Care Continuum of Care project, which is a project to engage with providers and their care coordinators on the ground to understand what resources they're using, how can we optimize their use of resources, including e-consults and those clinical guidelines. And so we've just started this January to March phase is a needs assessment process. So I've started to meet with providers on the ground with their care coordinator team to understand what barriers they're experiencing and what are their pain points with utilizing e-consults. And the Peer Mentor Care Collaborative team, some of the folks on this call are engaging in that with me as well, so that we can start to design some interventions and programs to really work to optimize that. This is a first step, and it works. This is kind of the easy first step because Stride is on the same healthcare record as CU. And so it's kind of the lowest activation energy to kind of start there. But the goal as well is that whatever we learn from this collaborative, that we'll take the learnings and expand that to other settings as well. I was just messaging Maisha directly because Salud, which also has an anchor FQHC in Aurora, also interacts with CU's e-consult program. They do that through an external program. That's just a separate, different technology interface, which makes things more complicated. But the goal is whatever we learn from this partnership and kind of initiative with Stride, that we could scale and kind of bring that to other FQHC partners that the CU e-consult program supports. And so we're just in the needs assessment phase. I'm a big planner. I think if we listen well enough, the answer becomes clear around what the right interventions are. So we are intentionally planning right now. Thank you, Myra, and thank you, Maisha. Yeah, would love to follow up about that. And so we're jumping into that right now. There's some other projects I'm working on as well, but I will say with the changing administration and things like that, I'm just kind of waiting to see what of those projects is going to still be on the table right now. I think the big one for me is engaging with Stride through their changing leadership. They've had some changes as well to keep pushing things forward. If anybody has any questions, happy to share and answer.
At our next meeting in May, as we talked about, we want to bring the providers together and just kind of brainstorm and get their view of the things that are working well within e-consults, theirs, what could be better, and what new ones innovations may be coming on. Is there a place for the HCPF e-consult platform to work together and with the CU one? Things like that we want to talk about. So it'll be interesting to explore. And also, it's a few more months to see what this federal administration is doing to us. And I think out there's kind of a gloomy picture in healthcare, but who knows? I think Mandy had mentioned that there is that new innovation, Cover All Coloradoans, which is important. Is that working okay? Is that anybody see that being impacted by what may be coming down? And of course, that covers pregnant women and children who are without documentation, which is kind of under attack these days. Are we still going forward with that? Or are there barriers that say maybe we need to hang loose a little bit, hang back a little bit? Anybody's thoughts on that?
I haven't heard anything new, in the last 6 weeks. I think it didn't launch in January. So I haven't heard anything new, but I think there's probably still quite a bit of information to come. And I think the other issue is people being afraid to utilize the service because it might put them at risk of being identified.
Okay.
Is the question, did it move forward and actually get enacted, or is the question how it's going?
Yeah, I think it's moving forward, but how's it going? And is it, as mentioned, is there some fear out there to actually engage in it? Are you seeing anybody seeing that right now?
Yeah, agree with Andy in the chat. There's about 12,000 individuals enrolled, and there have been questions around fear of enrolling, just like what it means to, like where the information is going. But that would be, I think who would be best to actually answer those questions. I don't think anyone here would be the best to answer those questions, but we do have, it does fall a little bit under my programs. So yeah,
I can
there is some fear.
speak like a teeny tiny bit to, we talk with the Rays regularly and have a standing update with one of our standing meetings with the Rays. And I think at our last update, they all said that things were going well, like operationally with enrolling people in the program and making sure that they have access to their benefits. I think there is still a lot of hesitation just about the program for these populations, and just the biggest push right now, I think, is to try and help people be comfortable overcoming that hesitation.
Bill, did you have something?
Rich, I was just going to say that at Colorado Access, what we're trying to do is stay very focused on the fact that our relationship is with HCPF, and that's our contracted responsibility. And if there are changes that are coming from the feds, that is between the state of Colorado and the feds, you know. And so I think there's some intentionality about, you know, whatever you want to call it, flooding the zone, and this is happening, and this is happening, and this is happening. And we'll really try to stay focused on what actually is changing. I think the thing that we are, in a more general sense, just with our Medicaid population broadly, are trying to pay attention to is that if the match starts to change, particularly with the Medicaid expansion population, which is currently covered, as you know, at a 90-10, if that were to go to even something like 80-20, that would double the cost for the state. And that's where some hard decisions would have to be made by the state. But I think still the goal is to try to stay focused on facts and not hyperbole. Do you know what I mean? It's very, in a fear-based environment, it's very easy to fall down in that hole. And but it's tough because, I mean, I'll just say personally, I have to limit the amount of news that I watch on any given day because I just like my life too much to watch too much news, you know. So I think in the same way, we need to stay focused on what actually is changing versus, you know, what rumors that we're hearing.
Yeah, and we don't know. I mean, we can just touch base on some of the stuff, but still we don't really know. More will be coming out. My concern is, and I'm trying to think of the term that keeps people with their green cards and immigrants out of Medicaid. And what's the expression that they've been guaranteed that if they're on Medicaid, they won't, public charge. I think this administration has all the power that it wants to do to remove that exception for public charge, which and begin to apply it. I don't know that they will, but certainly that's going to be a concern down the road. Okay, guys, anything else? What a wonderful turnout, what wonderful interest, caring, love that you guys have for the people who are.
I just had one other question to ask the group.
Okay.
And this was something stimulated by, I think, Carrie, you had made a comment about when people get together, you know, ideas start to generate. But one of the biggest take homes of this session today for me, and I put it in the chat, was that only 10% of the patients that were, you know, referred through e-consult actually required a face-to-face visit. Now, I'm a older family doctor, and I feel like the more we can do to figure out how to support primary care the better our patients will do. And actually, the fewer the patients will need to go on and see a specialist face-to-face, and thereby the patients that are seeing the specialist are actually ones that need to be there. So we actually create capacity by helping primary care, for lack of better terms, work top of license. And so that then pushes us towards whether one of our big solutions around addressing specialty access in the state of Colorado is improving the supply of primary care that actually has room in their schedules to see patients, to be able to care for patients that maybe are more complex because they have the supports of things like e-consult to be able to do that. I will tell you just from a lot of years of personal experience that when you are just going nuts, it's easy to just say refer, 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 because you just don't have the time and the bandwidth to deal with it. So sometimes it's not even a medical expertise so much that with a little help you could do it, but you just don't have the time. So I still think there's something else there than just, oh, we need more zoologists or whatever kind of ologist you want to say. There is something there to improving that work, improving the supply of primary care and improving their capacity that actually is going to also then help the specialty access stuff. So I just don't want to be too narrow, like, oh, I need to run out and get more of this kind of specialist, when sometimes it may be we're too focused in one part of the problem and not looking more broadly. So if any of the providers on the call have thought about that, I may be smoking something, but I'd really appreciate your perspectives.
Just say I agree. I'm a family doc too, and I think that's what the initiative at Stride that we're trying to start is all about, of how do we improve utilization of the continuum of when you have an unmet need, you're a provider and you don't know what to do in the moment, how do we meet that need in so many other ways? And I think that e-consults are an innovation, like having more public clinical practice guidelines are an innovation that's not just up to date, which is so dense. And that there's this other area of kind of the brief consult and the brief back and forth discussion that that is like an area of need. That then is another step that could be developed, but for figuring out how to, so I'll just say that like we're trying to start diving, I'm trying to dive into that at Stride specifically. So happy to talk more about that. And that resonates a lot.
Hi, I agree. And I just want to add something. In my presentation, I mentioned that the clinic, they can use one or more e-consult platform, not just limit to one. So I don't know exactly how many specialties are available in other platform, but I'm very confident about the Colorado Medicaid e-consult platform. We have 21 adult specialty and 16 pediatric. That is a lot. When I look at the list, it's overwhelmed myself. So I think through this session, the word of mouth, I encourage everyone to educate PCNPs. If you meet one, just to let them know, hey, you can join one or more platform just to look for the resources. If what platform doesn't work for your need, there's another platform available, because this is for the statewide, not just Medicaid or not just a specific healthcare system. I think it's for statewide. Thank you.
It's very optimistic. I appreciate Bill said, that we have the issue of supply and capacity, and we can work on both, but our focus right now, how can we increase that capacity out there? Given the supply, it probably isn't going to change in a quick amount of time. Anybody else? We have folks who are in the trenches of primary care, like Bill and Carrie and Maisha. Any perspective of them, those guys that are in those trenches, about what we talked about today? Is there a boost on hope? There certainly is a challenge to do better. Any more thoughts?
I'm staying grounded in hope because that's the only thing keeping me going. But yeah, I do want to just say before we jump off this call, I would, if Jacqueline, sorry, I didn't write down the phonetic pronunciation of your name. It's great to have a community member here today who can help speak to your own experience and what other people on the ground are experiencing. So I just wanted to make sure, I would love to hear from you, just anything you have to add before we make sure we end today.
Well, I'll make it really quick. I really appreciate the presentations. They were all very, very good. I also would be remiss if I didn't say I sit on the region 4 PIAC. And so getting this information really does fit with the work that we're doing on the PIAC. Little concerned about the limited input regarding behavioral health, but it still speaks to what was just said about, capacity and availability. So we're very concerned about the fact that there aren't enough providers who are providing, culturally competent or culturally relevant care. And so as a consequence of that, that feeds into this conversation about availability or the access to specialty care, because I think that in and of itself is a specialty care arena. I think the other thing that community members are concerned about is just the length of time, not just access, but just the length of time it takes to get those kind of referrals, especially if you are a Medicaid recipient. And then there's all the other concerns that you all mentioned about what is going to happen at the federal level and how it's going to impact us here in Colorado. And I think that there are a lot of people who are very, very concerned that if ICE will raid a school, why wouldn't they raid a public health entity? So I think that there are a lot of fears. And so it'll be really nice to see if there's any way that we can address a lot of those concerns. So yeah, I think that what you all are speaking to is very relevant. Thank you very much.
Thank you. Thank you, Jacqueline. Just a real quick thing, or maybe for Dana or Emily, we last time we talked about specialty innovation and maybe involving more behavioral health. Is that still going on before we close?
So in terms of behavioral health, we are not, so the short answer is no. I mean, we're still always open to explore opportunities to introduce behavioral health. But as of right now, behavioral health will not be participating in the specialty to specialty functionality.
Okay. I don't know. I kind of had my hopes built from the last time, but maybe I heard it wrong. But I know it's a challenge out there, Emily. Thank you.
Yeah.
Anything else from anybody as we close? I appreciate all of you guys being here and all the updates and the caring, and again, the love and the attention that you're taking to bringing forth here. We'll look forward to our next meeting, which will probably be a discussion of the providers and how are they all doing in their respective platforms and how can we learn from each other.
Thank you, Rich. And I just wanted to just add Happy Black History Month to everybody.
Thank you.
You can find some activities to participate in to celebrate Black Americans and our contribution to healthcare and to fortifying this country that we call home.
Thank you. Okay, guys. Great having us together. Thanks for sticking with us for an hour and 20 minutes. And this has just been such a delightful conversation. Delightful in that we're beginning to see some challenges that maybe we can begin to address better than what we're doing now. I appreciate all you guys' work and thoughts on this. All righty. God bless you all. See you next time.
Thank you.